The following scenes are based on actual case studies representing the stories of families who have experienced palliative care. The roles of Marie and her husband Jake are both portrayed by actors. This is Marie, a 54-year-old patient who was diagnosed over 1 year ago with advanced metastatic gastric cancer and bilateral pleural effusions.
Hi, Marie. I'm Dr. Kelly. It's so good to meet you. Hi, Jake. Good to see you, too. You may wonder why I'm here, but your oncologist, Dr. Gold, asked if I would come round to see you. He told me that you were experiencing more fatigue and that you were more short of breath, and he asked if I would look after you here at home. Would that be okay?
Yes. I want to stay at home. I don't like being in the hospital. I want to be here. I want to be here with my family and friends.
Well, we'll do our best to look after you at home. But sometimes there are extenuating circumstances or complications that occur, and we can't look after you at home. But I can admit you directly to the palliative care unit at the hospital. You will not have to spend long time in emerge at all. You'll go straight to the ward. The other option is to admit you to the residential hospice. Most people are able to be looked after at home, but I want to reassure you that if something should come up, we have some options. Now I need to tell you about my role. I'm here to support both of you. I'll be visiting you every week, and if you have any concerns that arise, you can call me. In fact, I have a sheet that I'll leave with you, Jake, and it gives a list of the doctors that support me. And there are two important phone numbers here for you. One are office numbers with the office hours, and one the pager number for off hours, so you can always get a physician. Just one little hint, don't use the pager number in the daytime, we turn it off. I know you have phone numbers for the nurses, and they can be reached 24 hours a day. The phone number is on the front of the chart. But we're going to do our very best to manage your symptoms. And I have to tell you that if we manage your symptoms well, you'll feel better and you'll function better. Now, tell me what's been happening. Tell me about your disease.
Well, I have stomach cancer. It seems so unfair, really. They took so long to diagnose it, and now there's nothing they can do.
I'm so sorry. That's really tough. I wonder, is there something you'd like to share with me? Something that you'd like to ask me?
How long do I have to live?
Well, that's a really good question. Have you been noticing any changes, any differences in the disease over the past month? Can you tell me what's been happening?
Well, my appetite's down, and I have no energy. And of course, I've had to wear the oxygen day and night now.
Well, these are signs that the disease is changing. These are signs that there's a progression. And I'm sorry, but you're going to gradually get more and more tired. And eventually you won't feel like eating, and you won't feel like drinking. And that's okay.
What about starting an IV if that happens?
Well, that, Jake, is a very good question. In fact, we get asked that question a lot. What you need to understand that as the disease progresses, the body functions begin to change so that everything, the brain, the heart, the gastrointestinal tract, the stomach, and the kidneys all begin to slow down. And when these organs stop working, if we were to start an intravenous, we would overload her and in fact make her sicker. So that's the reason that we don't do it. And I'm glad you asked the question because it's really hard in dealing with this because we who are well feel hungry, we feel thirsty, and we can't understand why Marie doesn't feel it. In fact, sometimes all we want to do is make her eat or drink. And that wouldn't be the right thing to do. And it's really, really hard to watch someone we love so dearly get sicker and sicker. As you listen to what we've talked about, are you worried?
Well, I'm worried about the pain, and I'm worried about the shortness of breath. but I'm not worried about dying.
Are you having pain now?
Almost none.
Well, I notice you fidgeting around in the chair a bit. Are you sure you're not having pain?
Maybe just a little discomfort. Yeah.
Well, let's talk about discomfort. If 10 is the worst discomfort you could imagine, and 0 is none, how much discomfort are you having?
Well, I guess about an 8.
Well, thank you for being honest. Now, I see over here beside you there are some dilaudid pills for pain. Have you been taking them?
Well, I take them once or twice a day, but I don't like them. They make me feel funny. I can't take any morphine or strong medication. I can't tolerate that, but I just don't like taking pills.
Well, I'll tell you what we could do for you. Instead of giving you pills, and pills that are really hard to cut, I could prescribe you the same medication in a liquid form. And so then we could give tiny doses every hour and gradually increase the dose in order to keep you from having side effects, but at the same time to relieve your pain symptoms. And the other good thing about taking this, and this is really important, it also will decrease your sensation of being short of breath.
Oh, yes, that would be good.
Well, we'll write a prescription and we'll make it happen. What about your sleeping? Are you sleeping?
Oh, I'm not sleeping well. I'm up several times a night, aren't I?
Maria, I see you have here some Ativan. Have you been taking the Ativan?
I don't like taking that. I like to be in control.
Are you afraid? Are you afraid you might not wake up?
Well, like I said, I like to be in control.
Well, how about trying this? How about trying an Ativan when you go to bed at night? And the new prescription of Dilaudid that I'm going to send over, start with a small dose of that as well and see if it doesn't make you sleep better. We know if you get a comfortable sleep, you'll be more rested, you'll feel better, and you'll function better.
Okay, I'll try it.
Now, what about the bowels? Have they been working? Have you had a good bowel movement?
Yes, fine. I had a good movement yesterday.
I'm pleased to hear that. Maria, I notice that you're sleeping with your husband in a regular bed down the hall, and you're lying flat. But with your disease, you need to be sitting up. You breathe much better when you're sitting up. So there are a few things that I'd like to suggest that might make things a little easier for both of you. First of all, I'll contact your case manager at CCAC, and we'll see if we can have a nurse coming in every day. She can monitor your breathing, check on the pain control, and help if there are any other symptoms that you're having. And I'd like to order a commode. Now, I know most people reject that, but it's a tough walk down the hall to the bathroom. And the other thing, the big thing, is your breathing. You really need to be sitting up like you are now in the wheelchair, and it's very hard at night if you have to lie flat. I'd like to order a hospital bed because it's electric. We can have you sitting up, and you could sleep much more comfortably. In fact, it would be really good to have it right here in this room. You could look out the window. You could listen to the sounds going on as the family cooked dinner. And Jake, I think you could sleep right here beside her on the couch. I'd also like to contact an occupational therapist because they can help come in and make sure that what you're doing is conserving energy, and that makes it easier on your breathing. So an occupational therapist would be helpful as well. And the last thing, I'd like to order a symptom management kit. It's a kit we have on hand with a variety of drugs to help handle a variety of situations in an emergency, and the nurse has them to use. Sometimes if something happens in the middle of the night or off hours, it's hard to get them. So it would be really helpful if we had that on hand, if that would be all right. Now, we've made some decisions today, and if these decisions aren't the right ones, then you can give me a call and we'll make a new decision.
I think these are all very good ideas, and it'll help us to keep you comfortable.
Well, we've gone through a lot of stuff today. Marie, you have to be exhausted. So it's time for me to leave. I'll see you next week. And if you need me, you know how to get a hold of me.